Okay, guys, so this is part two of important things I would know if I were a nursing student studying for fundamentals of nursing, right? So, something else I'd suggest for you to know when it comes to teaching. If you have to teach a patient about a diagnostic test or procedure or medication or anything, there are two things you have to do before you can start teaching. Number one, you have to assess that patient's readiness to learn. So if that patient just had an amputation and you have to teach them how to change a dressing, right? What's the point of trying to teach them to change a dressing if they won't even acknowledge that they have a limb missing, right? So you have to assess their readiness to learn. And the second thing, you have to assess how much the patient already knows. You don't know what to teach a patient until you know what they're lacking, right? So before you teach a patient anything, you always ask them, can you please tell me what you know about XYZ? And you kind of listen to what they say. And then when that patient's talking, that's how you figure out, okay, wow, I thought they were up here, but they're really down here. So I got to start down here. Or wow, I thought they were down here, but they're really up here. I got to start up here. So you're going to assess the patient's knowledge and assess their readiness to learn. You need to know about foods that are high in vitamin K. You need to know about the effects of vitamin K on the body. You need to know about Narcan. You need to know about what to do if you have an issue with a coworker versus a patient. And what I mean by that, if you have a problem with a coworker and it's something personal, you're always going to go to the coworker first to try to resolve the issue before you escalate it. However, if patient care is involved, if patient safety is involved, you never go to the coworker first. You go up the chain of command. So you would go to your immediate supervisor. So if I were you and you're studying for fundamentals, I'd read that test question very carefully. Is it something personal that has nothing to do with patient safety where you can go to the coworker first, or is patient safety involved? Then you bypass the coworker and you immediately go to your supervisor. This is based on a student that had a question. They said they're taking their HESI for fundamentals and they wanted tips. So these are the tips I'm giving you. If you have to do an incident report, what do you need to know about the incident report? First of all, you need to know that the incident report is never, ever, ever mentioned in the patient's medical chart. You cannot even mention that an incident report has been filled out. An incident report is a third-party documentation strictly for the organization or the facility. And you need to know the purpose of the incident report. The purpose of the incident report is not for punitive purposes to punish someone for doing something wrong. No, it's actually to make sure that whatever mistake happened before doesn't happen again so that processes can be put in place. So let's say a patient falls and they were injured or they were not injured. Either way, you're going to fill out an incident report. You're not going to write, the patient fell, unless you saw that patient fall. If you came into the room and you saw the patient on the ground and the patient said that they fell, you're going to document that patient observed on the ground upon walking into the room, because you did not observe them fall. They could tell you anything. And again, that does not go in the medical chart. You're not even allowed to mention an incident report. It's a third-party document, okay? And it's not for punitive reasons. You need to know that. You need to know when it comes to multiple sclerosis, what is going on with the patient, just a general idea, which the patient's going to have decreased motor functioning. So make sure you know that. Make sure you know your regular, what's the word I'm looking for? Not guidelines, but the normal therapeutic ranges for the vital signs, your pulse, blood pressure, respirations, O2 sat, partial pressure of oxygen. You need to know the norm, okay? Skin turgor, make sure you know how to assess skin turgor in an elderly patient or a patient that's very thin and frail. COPD, you need to know when a patient has COPD, are you going to give them very high oxygen because they have COPD, and we know that answer is no, right? Yeah. Um, Colostomy. You need to know how to perform colostomy irrigation. Make sure you review that. I think in part one, I talked about nursing math dosage calculations you need to know. Oh, traction. You need to know the difference between the skin traction and the skeletal traction and what your nursing interventions would be. So skin traction, we know it's not invasive. We know we want to keep the skin intact. We're going to assess for redness, stuff like that. Skeletal traction, we know that is invasive. We're most concerned about what? Infection. You know you're going to be cleaning the pin sites. Make sure you know about that. Make sure you know your teachings for your general teachings for a patient with hypertension. PMI, what does the P stand for? I know something of maximal impulse. Point of maximal impulse. Make sure you know where that's located. So if it's a point and click, you know where to take your mouse and click on the PMI. You know it's the midclavicular line, fifth intercostal space. Make sure you practice that. Make sure you know about hospice care, what it is, and the eligibility requirements for hospice care. What type of patients would you not put in a room with someone else? So obviously, if you have a patient with an infectious process, you're not going to put them in a room with someone else because we don't want that other person to get that infection. If you have to put two patients in a room together, it's going to be two patients without an infectious process or two patients with the same infectious process. Make sure you know the steps of using a nebulizer, right? If you have to drag and drop the steps in order, make sure you know how to do that. Make sure you know your positions, such as semi-Fowlers, high Fowlers, prone, things like that. Make sure you know your positions. Rule of nines. Make sure you know your rule of nines. Make sure you know the different torts. Make sure you know the difference between assault versus battery. They're not the same thing. They're usually used together, but there is a difference. Make sure you know where to check the radial pulse. If you have to place an eye drop, make sure you know the steps on placing an eye drop. What can you delegate to an unlicensed assistive personnel? So as a registered nurse, if you have 4 types of patient, what type of patient can you delegate to the UAP? Now, let me tell you something. The UAP and the LPN. The LPN is going to get the most stable patient. The UAP, you cannot delegate anything that requires critical thinking. Am I saying the UAPs don't know how to critically think? No, I'm just telling you to think that way so you can get the answer correctly. So, for example, UAPs, they can take vital signs, right? Can they listen to lung sounds? No, because if you're listening to the lung sound, you have to know the difference between crackles, rails, wheezing, but you can count respirations because that doesn't require critical thinking. That's what I meant when I said that. All right, part 3 coming up soon.